I'm going to talk about A Matter of Balance. I'm a master trainer for that program and have been for a number of years. And A Matter of Balance is an evidence-based program that originated at the Ribald Center at Boston University. And the design behind A Matter of Balance is to reduce the fear of falling in older adults who do have that fear, and then to have them increase their activity level. And it's designed for community dwelling older adults, but we do provide the program at assisted livings, we do it oftentimes at housing complexes, congregate meal sites, sometimes in conjunction with clinics or YMCAs or public libraries, really anywhere where we can get a community partner that would like to host a program. It is for older adults who are concerned about falls. So either they've fallen themselves oftentimes, or maybe it's that they just have a friend, a neighbor, a relative that's taken a bad fall, and they get that real concern about falling. And oftentimes they're starting to restrict their activities because of that fear. And then we also have people that want to do some simple exercises that will help with flexibility and balance and strength. So the classes are held, there are 8 two-hour classes, and they can either happen once a week for 8 weeks, but more often we hold them twice a week for 4 weeks. And in those classes, the older adults get to view, what we want to have happen is that they'll view falls as more controllable, that they can have some control over that risk of falling. We want them to set realistic goals to increase their activities so that they continue to do the activities that they enjoy and aren't restricting what they're doing, but maybe they just need to do things a little differently. We do a lot of practical ideas on changing the environment, changing things around the home, things they can do to make their environment safer, both inside and outside. And then we promote exercise that's going to increase that strength and balance. How this is done is that there's a lot of group discussion. The groups are usually between 8 and 12 participants, sometimes a couple more, sometimes a couple less, but there's a lot of group discussion. And then we do problem solving. Like I mentioned, maybe it's that they enjoy going to their grandkids' soccer games. Well, how are they what's the best way to walk across that field? Or how are they going to get up in a bleacher? And they discuss between themselves ideas for continuing to do activities. Cognitive restructuring, that's another thing, to turn that fear of falling switch it around so that they feel that they have control and they can make plans to continue their activities. There is some in assertiveness training, and that's for people to feel more comfortable in asking for help. Maybe they do need to take the arm of someone as they walk across an unstable surface. Or we've several times had in apartment complexes where the group has gone to the management and said, hey, we need an extra grab bar or an extra railing over here. Or have you noticed how our sidewalk outside is really uneven? So that assertiveness to ask for the things they're needing. Share practical solutions. Sometimes we have a show and tell of assistive devices that the participants use, or they just share how they have overcome obstacles. There are 2 videos that are shown during these classes, one about that fear of falling that they might have, and one that says it's never too late to start exercising. And then we do, starting from the 3rd session through the 8th session, we have simple exercises. I call them simple, gentle exercises, part of which are done sitting. The other part is where they do them holding on to a chair. So they are really exercises almost anyone can do. The participants do receive a participant handbook, and in that it has handouts, but it also has all the exercises listed out for them so they can continue, and we really encourage them to do these simple exercises at home. The outcomes have really been great. First of all, the class is fun and people enjoy it. So 97% feel more comfortable talking about falls, and that's something we really do stress, is that they need to let their healthcare providers know when they fall because there may be a simple solution to their problem. More often we find the people that don't want to tell their children if they fall. They have that real fear that their kids will worry too much. 97% feel more comfortable increasing their activity. Most of them, 98%, would recommend the class to someone else. And studies have shown that people who have taken this class, there's a $938 savings to Medicare. Lastly, I have a picture of my STAR class here. It's been 2 years ago in January. It's in Nevada, Iowa, in the Meadows, which is an apartment complex for older adults. And this group is still on their own 2 years later, twice a week, coming down to their community center and doing the exercises. So I use them as my stars.
Thank you. They're a good group.